Thank you, Tom and Marcia and the entire Cypress team for having us here today. As I was going through my notes and looking at how long we've actually worked with Cypress, we've worked with you now for 10 years. So that was exciting to see that we're also having a 10-year anniversary and actually having clients together for that long. So what we wanted to do today is talk about Magellan. As you heard, I'm Vice President of Sales, not a clinical pharmacist by any means, but we'll be giving you some pharmacy trend information as we go through the day in the presentation. Magellan Rx. Magellan Rx Management. To the right of the M, you've got a full-service pharmacy benefit manager with over 40 years' experience in pharmacy benefit managements. And then what I wanted to share with you just real quick is on the left of the M, you've got Magellan Healthcare, a behavioral healthcare company. They definitely are known. They've got the massive footprint for when it comes to behavioral health. And we carry that a lot over with our nurses and our care program. You see a lot of that behavioral health training going into the RX management side. And so we wanted to share that. And they're also an innovator in specialty solutions, and so we'll talk a little bit about that today. And just to give a lot of the folks in the room who aren't aware, some of the background and key statistics on Magellan Health. We have over 1.6 million members under PBM pharmacy management, over 3,091 employer health plans. We have, employer commercial groups, 42 health plans, and then also have about 10 million members under medical specialty management. And we'll touch on that a little bit about that today as well. What are we doing at Magellan? We are solving pharmacy challenges while focusing on the whole member. And so you heard a lot today from the various speakers, and including Adam. You need to be doing something a little bit different than some of the, what approaches you've used in the past, and you need to be able to look at all of the data. And so what we're doing is we're taking the medical data, the pharmacy data, we're integrating all of the data, and we're coming up with specific customized solutions for your particular plans. And so when you look at this, you're actually building beyond the core services. And if you had a plan 5 years ago and you were shopping pharmacy benefit services, you were looking at these core services. You were looking at discounts, rebates, contract terms, customer service. And today, as you've heard from a lot of the conversations today, there's such an evolving market with accountable care, with consumerism, with the drug, increasing drug costs and the growth in specialty drugs. You need to do something different. And so while we have the core services, but they're all volume-driven services, you also need to have that customized approach. And that approach that I'm talking about is more specific to looking at data, making decisions with the data, and having individual solutions for the members. I mean, thinking about it again, 80% of your spend is made up of a few specialty members. And so you're really wanting to look at that a little bit differently today than you had in the past. Some of the pharmacy trends that we'll talk about today, and Gary actually touched on it, the PCSK9s, they caused a lot of anxiety when they came out last summer. And there was two various drugs that a lot of folks were up in arms about because it looked like it was going to be the next high-cost drug options. We got a lot of calls from the various Cypress account management team and the sales team saying, what is Magellan doing here with these particular drugs? The cost of those drugs for treating the cholesterol was about $14,000, where on average to treat the cholesterol previously was $2,000 to $2,500 per member. And so now kind of up to date, we do have the two drugs, the PCSK9 drugs, on our formulary, but with high PA criteria. And actually the criteria indicates, and I'll just read it to you, that there needs to be 2 doses at the highest level plus Zetia to be tried and failed to get one of these drugs. And so because of the high criteria and the fact that physicians just aren't prescribing this as much as we expected to, in all of our data, we're not seeing PCSK9s at the top of our data as a lot of folks would have expected. So that was one of the items that I wanted to mention today. And another trend is on orphan drugs, and we're going to catch on some of these other ones kind of as we move through the presentation. But orphan drugs, for those of you that aren't familiar, there were 15 orphan drugs that were approved in 2014. And these orphan drugs treat diseases that only affect 200,000 folks or fewer. and the actual cost of the drugs for orphan drugs is 6 times that of a non-orphan drug. So it gives you, a feel for the cost and the scale when it comes to the orphan drugs and how expensive those are. The drug price inflation, drug prices rose more than 10% in 2015. You can see here 14.7% on brand drugs, 9.21% on specialty drugs, and then just under 3% on generic drugs. So that's just strictly inflation costs. And then FDA approvals in 2015, there were 51 total drug approvals, but 35 of those were specialty drugs. And so wanted to share that. That's 69% of all drug approvals were in the specialty market. And what's expected is that in 2020, 9 of the 10 best-selling drugs in the U.S. by revenue will be specialty drugs, compared to 3 in 2010, and then there were 7 in 2014. So it really gives you, the volume there. Some of the drug categories with the driving trends, definitely at the top of the chart, you're going to see oncology, autoimmune, Hep C, multiple sclerosis. But according to the IMS, in 2014, the United States spent almost $400 billion on pharmaceuticals, with $124 billion, or 33% of that, on specialty drugs alone, and then the spend on drugs to treat cancer was $43 billion, or 11% of the total spend on all drugs. And it's rapidly growing because they're expected to close with 800 cancer drugs in development today in the pipeline. So it just gives you a feel that that's going to obviously continue. With Magellan, you've got your comprehensive total specialty drug management, from, again, the comprehensive reporting tools to the clinical programs to the care nurses. You need to make sure you're working with somebody that has the entire solution. And then some of the solutions are listed out here for you. The adherence and persistence, you're going to hear more from Bryce today. We're very excited about the consumer tool that we've partnered on, where it's going to allow the members to go in and actually price and see drugs at various pharmacies. And so that's a tool that we want to show today. And, with all the members that, as you heard from Natasha and from Gary and from Kim, there's a lot more plans out there with the high deductible health plans, a lot more member engagement, a lot more, healthcare responsibility taken on by the member. And so with these types of tools, it's going to improve the adherence. As far as experts in the medical pharmacy arena, so Magellan has been doing medical pharmacy management for the last 12 years and have 10 million members under medical pharmacy management. What that means is there's 40% of the specialty spend that actually falls under the medical. And this is where it's a little bit different than the other pharmacies out there. You want to work with somebody, again, that's looking at the entire data, the medical, the RX, biometrics when it's available. Everything that you can, so that you can really look at that member at the end of the day and you can make determinations on where their spend needs to be. And there's situations today where the specialty drugs are being spent at a particular hospital and it's $10,000 for a site of care, when that could be shifted and maybe be $2,000 at an infusion center. So those are the types of things that we need to be looking at and that we can be looking at. So that's an example, as well as there's clinical edits that can be built in. And again, I know I keep harping on the data, but the data is really going to be key to determining what's going to be best for you and your plan, because it's all, unique to every group. As far as the Magellan Rx Cares program, these are the nurses that I mentioned that are behaviorally trained. So when you think about it, you've got a member who's newly diagnosed. They're scared, they have high anxiety, they're stressed out about their condition. So they're going to want to talk to a nurse who's motivated, who's behaviorally trained, that can that can detect patient avoidance or drug avoidance. And they're going to detect avoidance behavior. So the member gets them back on track with the next positive steps. So with this, the nurse helps the member with a clear path to better health, because they're walking through the various situations of what they can expect to happen and kind of what they should do in their next steps. Okay. Implementing and having the Magellan Rx Cares Management Program. You can see the various disease state classes that are specifically targeted, and then there's the expansion list in addition to that. But the keynote here is the medication possession rate is on average 5% higher when they do have a CARES nurse program involved versus not having one involved. and then it's 11% higher than the national average. And so again, it helps with the adherence. Member experience from a specialty perspective, you have the complete patient engagement with all the various tools listed here to the right. And one of them that I will go ahead and play for you here as we kind of talk about it.
Let's take a minute to talk about your medication. This is Enbrel, and you should administer it at the dose and frequency directed by your doctor. Before using Enbrel at home, you should demonstrate an injection to your healthcare provider so you feel confident doing it on your own. You should also know how to dispose of needles. If you have any questions, your doctor or pharmacist can help. Remember to always rotate your injection sites and only use Enbrel if it is clear and colorless. Enbrel is a medicine that blocks part of your immune system called TNF, which is causing unwanted inflammation in your body. With Enbrel, you may have injection site reactions, such as swelling or redness. This is normal and should go away in a few days. Other common side effects include headaches or sinus infections. If these or other side effects become reasons you want to stop taking this medicine, please talk to your doctor or pharmacist. Less commonly serious side effects can occur, so call your doctor right away if you notice unusual changes to your body, like bruising or bleeding, shortness of breath, or swelling of your face or lips. Enbrel may lower your ability to fight infections, so you should avoid exposure to illness and tell your doctor if you feel sick or have a fever. Also, Enbrel may increase your risk of a few types of cancer, so it's a good idea to check your body regularly and tell your doctor if you find changes like a sore that won't heal or a lump in your neck, groin, or under your arms. Watch for night sweats and weight loss too. You should store Enbrel in the refrigerator, but you'll want to allow at least 30 minutes for it to reach room temperature before your injection. Also, keep it in the original carton until your dose is due, because it protects it from light. For best results, continue Enbrel because it can help your condition, and read the medication guide for more information.
The QR code, what it does is you get the QR code on your prescription bottle. This is very innovative technology. It's totally a cool tool that's used for the members when they get their prescriptions from a mail order or a specialty setting. It has the QR code on there. You can scan the QR code on your phone, and a doctor is going to pick up when you hit the QR code, and it's going to give you a 2 to 3 minute tutorial on Enbrel or that prescription. It's going to give you all the side effects. It's going to give you all the information on that particular QR code. In addition to that, it's got the options for a Connect Me, where you can actually connect to a physician or a nurse over here to the left. You can remind me, it's a refill reminder, or to the right you can get additional information. So I'm not aware of another PBM that has that type of technology that's coming out on these specialty medications, and it's just a nice feature. It's less intimidating for the member, and I'm sure it's much easier than reading the 14 pages of material that we all read when we do receive a prescription. So in closing, what I'd like to do is just turn it over to Bryce, because I'm excited about sharing with you kind of our partnership and the consumerism tool that we brought today, and showing you that you're going to be able to be more engaged in the process, be able to price the prescriptions, and definitely let Bryce share with you the background on GoodRx. Thank you.
Thanks, Cheri. So under ideal circumstances. All right, here we go. So, diving right in. As Cheri said, and some of you may already be familiar with our consumer website, which is actually what I have here on the slide. I'm going to take a risk here. Show of hands, anyone use the individual website or have the mobile app? All right, a handful. All right, it's not completely bad. The people I planted in the audience. So, so you're one of the 4 million monthly viewers who we have visiting the website or our mobile app. So we've had pretty good traffic over the past several years. A lot of individuals using our site just on the consumer side alone. Now, GoodRx has been featured many times in the press over the past several years. So we've got pretty good name recognition, which we attribute a lot of that traffic to. But at the same time, for our return users who continue to come back and visit the GoodRx website and get information month after month, The feedback we're receiving is that the site is very helpful, it's easy to use, provides good information, and I think a lot of that goes back to our roots and our founders, and they've all spent their careers developing technology that is fun to use, informative, and very helpful. So back in 2014, just leveraging the success that we saw on the consumer side, we started to roll out our employer group products, one of the most successful being the one that we have set up with our partners at Magellan. And something we believe that really sets GoodRx apart from some of our competitors is the fact that we truly understand the importance of working alongside the pharmacy benefit managers. I think it's very important. And doing so really allows us to use that information to power our tool, in some cases using real-time pharmacy claims data. And this information is loaded into our alerts tool, and it produces customized outreach to individuals to give them more information about their prescriptions. So on this next slide here, you can see an example of what our alerts actually look like. This is something that would go directly to a member either via the mobile app or, through a text message or through an email. So bottom line, faster than our competitors, we're able to quickly analyze utilization and claims data and provide a full report back to an individual showing all the different possible ways that they could possibly optimize their next fill. So this really, with alerts, goes well beyond just a simple transparency tool. We don't like to think of it that way. In our minds, this is really a high-powered member engagement tool. As I said, we work very closely with PBMs, and we do so to help eliminate any redundancy and ensure more of a coordinated approach in identifying not just pricing, but also nuances of the benefit design and full clinical information. So we load all this information into alerts, and it's sent out using a highly customized electronic campaign via either email or text. Now, it's no secret to anyone in this room, I'm sure everyone would more than likely agree with this, but member engagement is probably the most challenging task on this planet by far. But in defense of consumers such as myself and many people in this room, the idea of shopping for any medical service whatsoever, it runs contrary to the training that we've received over the years. And up to this point, even still today, physicians write us the prescription. We take that prescription down to the lobby pharmacy or the pharmacy that is closest to our house, and we get it filled. And there's just not a lot of consumerism in that process, but that's just simply the way it takes place. But I'm happy to report that for our members, they're starting to get better. As you can see on the slide, roughly 80% are registering on the GoodRx website within 3 months of the effective date of getting this program in place. And then on a go-forward basis, about 2 out of 3 of every member, of all members, are continuing to read our monthly reminders or the monthly emails that go out or the text messages, or visiting the site to get more information, which is great. So as I said, this really goes well beyond just chasing the lowest price. We're also targeting very specific plan design elements. Such in this case, you can see on the slide, this particular client has a pill splitting program in place. Maybe you have a Retail 90 program in place. We're able to do very targeted engagement, very targeted steering for members. We're also looking at clinical options, such as possible therapeutic equivalents, maybe over-the-counter products that might exist to help a member. But in regards to price, we're really providing information to members that they probably never thought to ask for in the past. And most patients, and I would say most people in this room, would be very surprised were very surprised when you found out, maybe for the first time, that the exact same medication that you're filling today might be offered at half the price at a pharmacy that's less than a mile down the road. And I would say that most patients or most individuals, this just completely catches them off guard, but it's the type of information that we think that it's important for people to have this information. Not only that, but keeping track of all the different low-cost generic programs that are in the market today, the $4 programs, $5 programs. It's great information, but it can be a hassle trying to keep up with all the different programs that are out there. And even though this is a bit of a hassle and can sometimes be very overwhelming for members, in our opinion, it's certainly well worth the effort. And these are actual savings numbers that I have here on the slide. And these are for people who just simply continued to fill the exact same medication they had been filling in the past, but went to a different pharmacy that had the medication at a lower cost. And I'll be the first to admit I latched onto these numbers because of the shock value, but that doesn't make them any less real, and the numbers are in fact shocking. This not only happened in 2015, but this takes place today. And I know that often individuals, brokers, consultants are very concerned about the possibility of network disruption and just the resistance from members when it comes to having to change a pharmacy. But what we found in our research is that usually our fears in this area are really greater than the reality. For me personally, I would drive a mile down the road for $10, and I'm sure many people in this room probably feel the same way. But if we're talking about thousands of dollars annually, I mean, depending on, it's relative, but at the same time, I mean, this is easily car payment, a good portion of rent, mortgage, whatever it might be. It's significant dollars here. So, and of course, that's not to say that people aren't resistant to the idea of change. We all know that they are, and that's why member engagement can be rather difficult. But in most cases, we found that this is really just simply a matter of inertia more than anything. We have a ton on our plate these days, and the idea of having to reach out to our physician, order a new prescription, having that sent to a different pharmacy, and then waiting for that pharmacy to call us back. This can easily turn into a multi-day project, and we don't have that kind of time. Poor Adam has 4 kids under the age of 3. I mean, we're busy these days, so it's understandable. So GoodRx, working with our partners at Magellan, what we've developed is a way around this. We simplified the process. And on the web or your phone, we allow individuals to transfer all or just simply one of their medications to a single or to multiple pharmacies, actually. And in a minute, I'll show a web demo here where I can show you our Smart Shopper tool, which allows individuals to target the lowest cost pharmacy without having to drive all over town to find the best price. So looking back at 2015, I think we're finally starting to see the potential impact on pharmacy spend when you have a really strong member engagement program like this in place. And again, getting people engaged is a struggle, and it will probably continue to be so. But when we're looking at the clients, and you can see here on the slide, these are clients that are shared by Magellan and GoodRx, you can see that when you compare their trend to the National Drug Index, the difference is truly significant. It's been very, very impactful. But as I said earlier, the goal of GoodRx and our founders since inception has always been to provide a very valuable service. We want people to enjoy using our product, and we know that they can. We want them to know that they can trust us to provide the best information and helpful information that they'll continue to come back to the site and obtain as often as they need it. So the site that we've developed with Magellan really gives a full dashboard for members and everything related to their pharmacy benefit. As I said, this is being powered with real-time claims data from Magellan. And so we not only have information around pricing, but we have information around accumulators. So someone's looking at where they are currently with their deductible. They're looking at what medications they're currently taking, as well as what medications other members of their family might be taking. We're tying into the pharmacy benefits, so we also have information, again, that's plan specific. Anything, like I showed the example earlier of a possible pill splitting program or maybe a 90-day retail program. This can all be very targeted depending on the group. I showed you the pharmacy transfer tool, and what that allows individuals to do is we will show the prescription that they're currently taking, and then we will provide them with the different prices of other medications in their area. And with a single click, actually there's a click and then there's a confirm, but it allows individuals to transfer that medication directly to that pharmacy. In cases where someone might be taking multiple medications, you actually have the ability to find one aggregate price. So let's just, if maybe the lowest cost price for one medication is at Walgreens, but if you wanted to fill all 4 at the same time, together, the lowest price would be found at a Rite Aid. Then you'd be able to actually see that information and transfer all of your prescriptions to that single pharmacy. So it's very helpful, again, at not only providing the lowest cost option, but keeping individuals from driving all over town to have to track that information down. Thank you all very much for your time. Sorry about the technical difficulties, but